Hi, my name is Nicole Simpson, and I'm a nursing student at Aspen University, here to talk about the syndrome of inappropriate antidiuretic hormone, SIADH. The posterior pituitary gland releases antidiuretic hormone. This hormone acts on the distal tubules of the kidney, signaling for reabsorption of water into the body. When and how much, so that the body does not just excrete all of the fluid water through the urinary tract and out the body. So, with this disorder, SIADH signals for too much ADH, which then increases the reabsorption of water in the body, generating fluid retention. This fluid retention obviously increases fluid volume within the body that dilutes sodium, causing the body to become hyponatremic. Causes for SIADH would include central nervous system complications like infections, meningitis. It can also be caused by multiple sclerosis, Guillain-Barré, bleeding that increases intracranial pressure, usually due to some type of trauma. Also, respiratory conditions such as pneumonia, COPD, cystic fibrosis, and asthma, I believe. Cancers are another issue. Small cell cancers that can cause SAIDH. And finally, medications. So, medications like SSRIs, sertraline, or anti-epileptic, anticonvulsive medications like carbamazepine act secondary to development of SIADH. Sorry, both can cause hyponatremia, weight gain, and insomnia. So, the metabolic profile of SIADH consists of blood and urine levels of certain substances within the body. So, the clinical manifestations would be low serum uric acid, hyponatremia, and low serum osmolality. And in the urine, you're going to have high uric acid, hypernatremia, and high urine osmolality. So if you think of it, the blood levels will be low and the urine levels will be high. Other signs and symptoms for SIADH would include weight gain, high blood pressure, high heart rate, bounding pulses, and have low urine output, decreased sleep or insomnia, low level of consciousness, decreased body temperature, um, low deep tendon reflexes, and GI disturbances. So, with all of those things, for a nurse, what do we do? Well, we're going to make sure that the patient is on fluid restriction. We're going to check eyes and nose and daily weights. We're also going to make sure, because of that fluid restriction, that we do oral care to keep their mouth moist. We're also going to assess for intracranial pressure um, and set up for seizure precautions, because the extra fluid can cause a shift in the brain that may trigger a seizure. We're going to do daily labs, BNP and BMP. We're going to check the IV, make sure that it is patent and free of infection, no pain to the patient. We're going to do ECG monitoring, vital signs regularly, and medication management, loop diuretics, Lasix, and we're also going to give demiclocycline, which is a ADH blocker. Now, complications for SIADH would include seizures, depression from the CNS, or from self perception issues because of weight. There's going to be muscle cramps, memory or confusion problems, headaches, tremors, and unfortunately, comas. So I hope you enjoyed my presentation on SIADH. Thank you.